All there is to know about oral health and omega-3 fatty acids. Why dental health is so important. Oral and dental health is a vital part of your overall health and well-being. Poor oral and dental health not only causes gum disease and dental cavities, but studies are showing links to diseases such as various cancers, type 2 diabetes and even heart disease, to name a few. And just the regular cleaning of your teeth helps to minimize the risk of these and similar health problems arising. How often do you clean your teeth, and how do omega-3 fatty acids help? In this and the following video, you'll find out all there is to know about oral health and omega-3 fatty acids. You'll also learn of some frightening links between your oral and dental health with your overall health, along with some simple and effective solutions that omega-3 fatty acids provide to help improve your dental and overall health. Before then, if you'd like to get an ongoing collection of news, reports, resources and courses on various other health and wellness issues, please click the subscribe button in the bottom right of the video screen, then click the grey bell icon, so you don't miss out on future videos, and then please leave a comment or ask a question below this video. It's so very easy to do. Plus, watch this video to the very end, where you'll gain access to a special report that you can download as a free PDF. Remember, cleaning your teeth is for life. It's one of the first and easiest habits to embrace as young children. And as we grow up, we're then introduced to the importance of flossing and eating healthy foods such as apples. But one aspect we don't pay much attention to at that time in our lives are the dangers of sugary foods like sweets and cakes, and let's face it, as kids that's what's eaten a lot of the time. So, are you now paying the price of ignoring that advice? And I don't just mean with regard to your dental and oral health, because your overall health is impacted as well. The video covers 1. Some stark facts about your oral health. 2. How to keep your teeth and gums healthy. 3. The symptoms of dental and oral health problems. 4. Causes of dental and oral diseases. 5. The role of omega-3 fatty acids, and 6. Diagnosing oral diseases. The next video covers 7. Diseases and problems of your mouth. 8. Cancer of the mouth. 9. How your oral health is inextricably linked with your general health. 10. Why it matters who you are. 11. Why diabetes sufferers are at particular risk with poor oral health. And 12. Why vanity is good for oral health. So, let's now sink our teeth into all you need to know about oral and dental health and omega-3 fatty acids. Number 1. Some stark facts about your oral health. Dental cavities and gum disease are very common. According to the World Health Organization, 1. About 3 in 4 school children have at least one dental cavity, whilst virtually every adult has at least one dental cavity. 2. 1 in 5 adults between the ages of 35 to 44 have severe gum diseases. 3. 1/3 of the world's population in the 65 to 74 age group have no natural teeth, and 4. Oral cancer is increasing, with about 10 out of every 100,000 people being diagnosed with it. Number 2. How to keep your teeth and gums healthy. The following steps are really common sense steps, but how many of them are you following? 1. Brush your teeth first thing in the morning and before you go to bed at night. 2. Floss your teeth once a day. 3. Stop eating processed foods. 4. Replace processed foods with fresh foods such as fruit and vegetables, and fish and meat. 5. Stop smoking. 6. Drink plenty of water. 7. Do you have your car serviced at least once a year? Good. Now go and treat yourself to a visit to your dentist every 6 months to get your mouth serviced to ensure your dental health is being maintained. Number 3. Symptoms of dental and oral health problems. Visit your dentist if you suffer with any of the following. 1. Ulcers and sores that don't heal after 10 days. 2. Bleeding gums after brushing or flossing your teeth. 3. Excessive bad breath. 4. Sensitivity to hot and cold food and drinks. 5. Toothache. 6. loose teeth and receding gums. 7. Painful jaw. 8. Collapsed fillings and broken teeth, and 9. A dry mouth on a frequent basis. Number 4. Causes of dental and oral diseases. Just like the bacteria in your gut, there's good bacteria in your mouth, and then there's a lot of bad bacteria that passes through your mouth and stays in your mouth. There are 2 key problems that bad bacteria create in your mouth. 1. The acidic nature of the bad bacteria is the reason why the enamel on your teeth wears away, causing discoloration and dental cavities, and 2. The accumulation of plaque around your gums. If left untreated, that is, you don't clean and floss your teeth, the plaque builds up as it progresses down the inside of your gums to the roots of your teeth, and creates an inflammatory condition called gingivitis. Left untreated to the point that your teeth loosen means you've now got periodontitis. So, in addition to the common sense steps to follow as shown in number 2 above, other factors that contribute to gingivitis and periodontitis include 1. Diabetes. 2. Medications with side effects, such as dryness in the mouth. 3. AIDS and HIV, and 4. Hormone changes in women, especially during pregnancy. However, the 2 diseases of gingivitis and periodontitis are something to avoid, because they represent inflammation at its worst. Number 5. The role of omega-3 fatty acids. Any condition that ends with itis, such as gingivitis and periodontitis, means inflammation. In this case, gingivitis refers to inflammation of the gum, whilst periodontitis refers to inflammation of the tissues and the bone supporting the teeth. The type of inflammation referred to here is chronic inflammation. Nearly all articles and reports that you read about concerning dental and oral health refer to the poor maintenance and cleaning of your teeth as being the root cause of these diseases. But there's one underlying factor that gets overlooked, that is in fact fundamental to both your oral health and your overall general health. And that's the maintaining of your cellular health, which is where the crucial role of omega-3 fatty acids come into play, as follows. 1. The basis of your cellular health is the balance of your omega-6 to omega-3 fatty acid ratio. 2. These 2 omegas are referred to as essential fatty acids. 3. They're essential because your body needs them, they're the building blocks of every single cell in your body, and the only way to obtain them is from your diet. 4. Omega-6 fatty acids are inflammatory, whilst omega-3 fatty acids are anti-inflammatory. 5. Since the introduction of man-made processed food after the Second World War, our diet of fresh food has declined alarmingly, in terms of both quality and quantity. 6. To get all of the nutrients, vitamins and minerals your body requires from fresh food also requires your body to be very active, which, as you know, most people are not as active as they should be. It should be of no surprise to anyone to highlight the increasing rise of obesity and diabetes cases, which oral health is particularly sensitive to. 7. Today, our lifestyle falls down on both fronts. Most people don't get anywhere near the sufficient exercise required, and the manufactured food we all consume is devoid of the right nutrients, vitamins and minerals, and substantially replaced with harmful sugars in the form of colorings and flavorings and other artificial ingredients and chemicals, such as processed vegetable oils. If ever there's a concoction of a witch's poison potion, this is it. 8. What this means is that your cells become inflamed because they have too much omega-6s and insufficient omega-3s. 9. So, when it comes to your oral and dental health, you face a double whammy. Firstly, if your cellular health is inflamed, which it is for most people, you can check by taking a simple dry blood spot test. Your gums, tissue and bones are undermined and constantly under attack from within your body, and secondly, the buildup of bacteria in the teeth and gums in the mouth attack the undermined tissue and teeth from the outside. 10. The task then is to help your body to redress the cellular health imbalance, as follows. A. Cut out from your diet the processed and ultra-processed foods, such as fast food, takeaway food, microwave food, cakes, sweets, chocolates and fizzy drinks, and B. Replace with fresh fruit and vegetables, and fresh fish and meat. 11. The omega-3 fatty acids and the lesser-known anti-inflammatory polyphenols are obtained from the fresh fish, such as wild salmon, anchovies, sardines, mackerel and herring, whilst additional polyphenols are also obtained from berry fruits. And, of course, all of the other nutrients your body requires are obtained from the fresh vegetables, fruits, fish and meat. So, whilst maintaining your oral and dental health is crucial, ensuring your cellular health is in balance is absolutely critical. Number 6. Diagnosing oral diseases. The main reason for having regular visits to your dentist is so that they carefully check your 1. Teeth, 2. Mouth, 3. Tongue, 4. Throat, 5. Jaw, 6. Cheeks, and 7. Neck. They'll also take X-rays of the teeth and bone structure of your mouth. As a woman, ensure you tell your dentist if you're pregnant. They should ask you this anyway, as pregnant women mustn't have X-rays. Your dentist will use various tools to help them check your gums and cavities, and they'll also check what's on your tongue. Any unusual lumps or growths are usually checked by taking a biopsy for a small piece of tissue to be sent away to a laboratory for analysis. As well as gingivitis and periodontitis, the laboratory should also check for cancer. In the next video, you'll discover Number 7. Diseases and problems of your mouth. Number 8. Cancer of the mouth. Number 9. How your oral health is inextricably linked with your general health. Number 10. Why it matters who you are. Number 11. Why diabetes sufferers are at particular risk with poor oral health, and Number 12. Why vanity is good for oral health. In the meantime, here's your special report to download for free, entitled, Taking Care of Your Teeth and Mouth. Click on the URL link in the description box below. Finally, here's the disclaimer you've been waiting for. And now, here's the boring, but very essential bit. Kindly note, the content of this video is not to be construed as medical advice in any shape or form, and has been created for passive informational purposes only. End of boring, but very essential bit. I hope you found this video helpful, in which case, please hit the like button, subscribe to the Omega-3 Zone YouTube channel, and feel free to share with others you think will find this content helpful. In the meantime, and until the next video is released, bye for now.